We've used the Elsevier EAQ testing for a long time. We've been using that, and we've been using the Elsevier HESI exams. So those have been on board with us for a long time. Having the new things and exposing students, because they were always saying, we want more electronic charting access, we want more questions, access to questions. So having SheerPath and having SimChart and all that has been a big thing for us, because we use it a lot, especially in the adult health classes and fundamentals classes, and I use it all in assessment as well. Some of the benefits using SheerPath has been being able to allow students access to more questions, because that is a rule of thumb for NCLEX. The more questions they have access to, the higher the possibility of them passing NCLEX. Being able to give them quizzes that we assign for grades, and then their ability to access those questions on their own as well. They also can access their book through SheerPath, so I assign those chapters, which is nice because they don't have to then switch over to their book and then come back to SheerPath. It's all right there together. So SimChart has been a blessing to us. I start with it once again in my class. I teach nursing assessment, and they use it when they do their weekly assessments on each other, just as a basic tool. Then in fundamentals through the Med-Surg classes, they are starting to use it for their patients at the hospital. And we started out basic, letting them just chart those basic things, vital signs, all the assessment stuff. We're hoping in the next semester or two to implement our care plan into SimChart and have that as just the assignment for the student for their clinical day. We also use the HESI testing in a lot of our classes. We use it in fundamentals, all of our adult health classes. We give 2 HESI exit exams. The first one is given at the beginning of their last semester, and the second one is given at the end of their last semester with remediation in between there. We do use the HESI remediation, and we have someone who does the remediation with the students one-on-one. Using that seems to work well, because students, they're a little leery at first, but then they get in there in those packages and they start to realize what they don't know, and they see that those packages, those remediation packages, really allows them to say, oh, I didn't understand this, let me go back and review it. It's just been one of those things where it's just all encompassed. We've used a lot of different things, and it's been successful as far as our NCLEX pass rates and stuff.